Thyroid disorders in pregnancy and before pregnancy. Like any female who is suffering from thyroid disorder, not only female, if males are also suffering from any thyroid problem, then it definitely is a matter of concern, and people should get themselves checked up before they are landing up, before or after they land up in any of the clinics. So firstly, let us come to females who are suffering from thyroid problems. So females who are suffering from thyroid problems, usually we grade thyroid disorders like whether they are having hypothyroidism or thyrotoxicosis. So, and then we need to see that whether it is due to deficiency, due to some autoimmune problems. So we need to diagnose the female by doing some blood investigations and ultrasonography of the thyroid gland, as well as after that we do send the patient to endocrinologist to check for if there is any other problem. So they do many nuclear uptake tests also for the thyroid gland. So coming to like conception portion, if the patient is only having deficiency, usually the patient doesn't suffer any problem during the conception time. The patient, he or she conceives automatically, but obviously they will have problems in the carry forward of the pregnancy. But if the patient is having autoimmune problems and because of that the patient is having thyroid disorders, then definitely they suffer infertility and they land up with us before the conceptional phase. So the patient needs to be diagnosed thoroughly that why this thyroid disorder has turned up. Secondly, when the patient has conceived and then they are diagnosed with very elevated TSH, then they land up into multiple recurrent abortions. For this also the patient needs to be given proper medications, the diet chart is made properly for the patient so that they adhere to the diet and accordingly the thyroid levels are monitored. Secondly, if the patient has to see that whether they are on thyroid medications which are suitable during pregnancy or not, because if the patient is suffering from thyrotoxicosis, you have different sort of drugs which some are acceptable during pregnancy and some is not acceptable during pregnancy. So it is a foremost thing that the patient sees all this. So these are some of the problems. And thirdly, the child also can have thyroid disorders. So congenital hypothyroidism can happen in the child if the thyroid is not well controlled. So thyroid is a very important organ that is responsible for the in the reproductive age group, and you should be very particular that you should have a proper thyroid levels. In males also, in many cases patients who are having abnormal sperm count, they also have increased or decreased thyroid levels, and they are also having autoimmune problems. That is also one of the causes that they are suffering from infertility.